Okay, so this is basically my chapter 4, cell stress and adaptation for pathophysiology, where I'm gonna try and break down the monster that was last week's patho lecture. Okay, so first off, we're gonna start with a cell, right? And she's not happy because she's undergoing some sort of, wait, that's too thick. She's undergoing some sort of stress. Now, when a cell is undergoing stress, there's two main things she can do, or he can do, or it can do. Cells don't really have genders, okay? I guess, no. So, or it can do. And that's, it can either adapt, like this guy, or it can not adapt, like this guy. And if it does not adapt, then it's gonna die, right? So, this is kind of our pathway here. So, a cell is stressed, she either adapts or does not adapt. And if she does not adapt, she's gonna die. Sometimes, even when a cell adapts, it still ends up dying because of the severity of whatever stress that it's undergoing. But we're just gonna focus on it adapting. So that's the first part I'm gonna talk about because this pathway is much more complex than this one for now. So we're just gonna focus on this. So when a cell adapts, right, like what type of adaptations is it undergoing? That's when we're going to discuss atrophy. Well, there's 5 actually. There's atrophy, hypertrophy, hyperplasia, metaplasia, and then we have dysplasia. But you can see like dysplasia is a different color from everything else. And that's because dysplasia isn't really a type of cellular adaptation. It's more of its own thing, but it is kind of similar, so it's in this category, but it's not the same. But we'll get to that, right? Let's start with atrophy. So atrophy is basically when a cell shrinks. I'm trying to make this bigger so you can see it. Yeah, it's when a cell shrinks in size, right? So it goes from being a really big cell to being a really small cell. And this usually happens because of a disuse of organ tissue. So and there's physiologic and pathologic examples of this. Physiologic is basically something that the body does in response that is normal. Pathologic is something the body does that usually leads to a form of disease or sickness or something bad, right? So physiologic is something normal that the body does, whereas pathologic is something abnormal or a disease or a sickness. So think about it this way. Physiologic is good, pathologic is bad. Oh, I guess that should be red. Okay, so a physiologic example of atrophy would be ovaries shrinking in menopause. And this is because when you get older as a woman, you stop producing estrogen. And because of this, your ovaries start shrinking. And you think about it, right? And it makes sense because if you're 60, 70 years old, you don't want to get pregnant. Like it's a lot on the body. And in your old age, you're not as well adjusted to handle having a child. And the body understands this. And because of this, your ovaries are more likely to shrink during menopause. Okay? And a pathologic response to this would be your muscle atrophying from disuse. So say you went cycling, or remember in class, Dr. Sheen was saying this is not the time to be trying new things. And she said this dude went rock climbing and he fell and he broke both his arms and his arms had to be put in a cast. So while his arms were in a cast, he wasn't able to move them. He wasn't able to use his muscles. So because of that, by the time his arms are out of the cast, they're going to be smaller because they're atrophying because they haven't been used for such a long time. That's basically atrophy in a nutshell, okay? So now we're going to go to hypertrophy. So I'm going to reduce this because we've talked about it. Now we're going to go to hypertrophy. Ooh, shouldn't have done that. Okay. Now we're going to talk about hypertrophy. I'll make this way bigger so I can see clearly. Okay, hypertrophy is basically when a cell increases in size, okay? Let's see. Increases. So you go from being a small cell to being a big cell. This usually happens in permanent cells that cannot divide. Cannot divide being the key word here. So we're looking at our heart cells and our muscle cells. So a physiological response to this would be, as a bodybuilder, when you exercise your muscles, they're going to get bigger, right? And that's why you see guys go to the gym and then after like a year, they're buff and swole because their muscles get bigger as a result of working out, right? Your muscles, in this case, they undergo stress, which is all the excess weight that you're lifting. And this stress makes them to get bigger so that they can adapt to lift more weight. That's basically a really good example of this. And a pathologic response would be when somebody has high blood pressure, right? They're pushing a lot of blood out of their heart. They're pushing blood at a faster rate because it's just a lot of blood. So your heart walls are going to get thicker as a result of this. And one thing I do want to mention is that pathologic and physiologic responses are not mutually exclusive. And so this basically means they're not separate. All right, just because something is physiological, something can start off as a physiological response and eventually become pathological. For example, if a bodybuilder uses like some sort of steroid or like hormone inducing drug to make his muscles bigger, eventually he's going to start putting a lot of strain on those muscles and he's going to start putting a lot of strain on his heart. And this is going to cause his heart to also get thicker, right? But it now becomes pathologic because the body cannot handle this, right? Because even though your muscles are adapting, the stress factor is getting too much and it cannot handle it. And eventually this could lead to things like cell death and, muscle spasms and whatnot. So just keep that in mind that something can be physiological, which is good, and become pathologic, which is bad. Okay? Okay. So let's make that smaller because we've done that. Next, we're going to talk about hyperplasia. Oh, also, I want to mention, before we keep this topic, what helps me remember is I think of bodybuilders, right? And when you're a bodybuilder, you win trophies. So hypertrophy is bodybuilders, and bodybuilders increase in size, like they increase in muscle size. So that's how I remember that hypertrophy is increase in size. Okay? And the other thing that's not hypertrophy is hyperplasia, and that's what we're going to talk about now. Okay. I'm trying to make it as big as possible, but it's hard. Okay. So hyperplasia is when a cell increases in number. All right, number. That's the most important thing here. So it goes from being one small, really lonely cell, like, oh, look at me, I'm so lonely, to plenty of cells. And this is more common in stem cells, like skin cells or uterus cells or liver cells, because they can divide. Cells that experience hypertrophy do not divide, okay? They don't divide, which is why they have to get bigger. Cells that experience hyperplasia can divide, so they do. So if somebody gains a lot of weight in a short amount of time, their skin cells are going to be rapidly dividing to accommodate all this extra weight. Okay, so a physiologic example of hyperplasia is your breast tissue increasing during pregnancy, right? So you start having more breast tissue cells so you can produce milk for your upcoming baby or whatever. And a pathologic example would be an increase in uterine cells due to excess estrogen. So say for some reason unknown to us at this point in time, your body starts producing more estrogen. This is going to cause your uterine cells to also increase in size. And this can lead to cancer. So that's just an example of that. Okay? Then we have, I'm gonna reduce that, get her out of the way, reduce this. Okay, then we have metaplasia. And this is basically what happens when a mature cell type is replaced with another type of cell to combat stress.